On the Medical Watch, depression. It affects an estimated 1 in 15 adults in any given year. It's the leading cause of disability and loss of productivity in the world. For some, it's absolutely debilitating. But when conventional treatments fail, what's next?
It affected me every day.
Jason Prinzo's struggle with depression began as early as first grade.
So my history with depression started when I was really young because of some things that was happening with my family and abusive father and alcoholism.
As he grew older, anxiety took its grip.
If I would call my boss and my boss wasn't able to pick up the phone, in a matter of a few seconds, I would go from, he can't pick up, he must be mad at me, I'm gonna lose my job, we're going to lose our house, my wife's going to leave me, I'm going to be back living in a one-bedroom apartment.
But at the same time, it was the daily side effects of the more conventional medications he was taking that left him equally debilitated.
I found myself being tired every day. It was affecting my personal life, my work life, my home life. It was bad.
Okay, sweetheart.
All right.
This is Jason's 9th infusion of a drug typically found in the operating room, a type of anesthesia for sedating patients. Ketamine has been in use in humans since the 1970s. You also may find it on the street. It's a known club drug called Special K, taken for its hallucinogenic effects. And now, at a growing number of ketamine infusion clinics across the country, you'll find patients rolling up their sleeves for a slow drip of what's been found to be a fast-acting antidepressant.
Patients who have suffered for 20, 30 years of depression, have tried multiple medication regimens, electroshock therapy even, we'll see them respond to ketamine in just a matter of a few days.
Anesthesiologist Dr. Balnandra opened his clinic IV Solution in downtown Chicago about a year ago. Administering the drug in small doses and what's called off-label use, he treats patients struggling with a variety of mood disorders, including anxiety, PTSD, OCD, and most commonly, depression.
We mostly deal with treatment-resistant depression, meaning that depression that has failed 2 or more regimens of different classes of medications as well as various therapies.
That's where ketamine seems to shine for the estimated 1/3 of patients who experience little, if any, relief after taking more conventional treatments. And for suicidal patients, it can be life-saving.
Ketamine has been shown to be well over 75 to 85, 90% effective against suicidal thoughts within just minutes to hours.
At Dr. Nandra's clinic, patients get 6 treatments up front, spread out across the course of 2 weeks. During each session, blood pressure and heart rate are monitored. The drug can increase both to dangerous levels.
Ketamine is a dissociative drug. It allows patients to react less to their impulses and separates their thoughts from their emotions and their reactions to those emotions.
You feel like you're dreaming a little bit. I felt like I was moving a little slower and things were a little blurry, but as soon as the treatment was over and you kind of come down, so to speak, I'm a little tired afterwards, but within 45 minutes to an hour, I'm back to normal.
The therapy comes with a hefty price tag, $500 to $800 per treatment. And because the drug's not FDA approved to treat depression, patients pay out of pocket.
There's a stigma with mental illness that it makes you weak. I don't even think I knew how bad I was prior to starting the ketamine treatments. My drive is back again, and I feel like the lighthearted, kind of fun guy that I know that I am, that the mental illness was kind of trapping inside for a little while.
Scientists used animal models to better understand how ketamine works in the brain. Unlike conventional antidepressant medications developed to target chemical imbalances, ketamine appears to rapidly change how brain cells connect and communicate. The finding has sparked great interest. Several pharmaceutical companies have ketamine-like drugs in the works. One is an intranasal solution psychiatrist Dr. John Zajeka recently tested at Rush University Medical Center.
It's one hit in each nose. We've seen people who have responded. We've definitely seen people who get better.
University of Chicago Medicine psychiatrist Dr. Elliot Gershon has been practicing for 50 years, and he's recommended ketamine for some of his own patients.
You have to be cautious about new developments in treatment. So even though I think this is looking good, I won't be sure for a few years, and I don't think the profession will be sure for a few years. But now, for people who are particularly treatment resistant or particularly at risk of suicide, it's reasonable to prescribe.
What's not known is how long the effect lasts. It varies from weeks to months depending on the patient. If symptoms return, patients often opt for ongoing maintenance doses, like Jason has. But mental health experts are debating whether maintenance doses are appropriate. A task force assembled by the American Psychiatric Association cited a lack of large-scale trials to determine the drug's safety and efficacy for mood disorders, along with a lack of regulatory oversight of clinics as a reason for cautionary use.
It's off-label use. So my recommendation always is, yes, people need to have an informed consent if they're doing something like this. They need to be aware of all the risks and the potential benefits.
Not all ketamine infusion clinics follow the same standards of care, so doctors do warn you have to do your homework. Some of the most well-respected experts in mental health believe ketamine may revolutionize the way depression is treated, but they want to form a registry to track the drug's use and learn more about how ketamine can help patients.